Morning, everyone. This is Carolyn McAloon. Thank you for sharing with us that we have a quorum for today's board meeting. Everyone, welcome to the last Podiatric Medical Board meeting of 2023. Woohoo! Do I have my mic on properly?
Yes.
Fantastic. Thank you, guys. It's hard to know without looking at each other. I am
Dr.
looking forward to
McAloon.
looking at your beautiful faces, and the next time we meet, we'll talk about that in a little bit. However, I'd like to welcome everyone to this meeting, both our board members, our DCA staff members, and our members of the public. I'd like to particularly welcome our newest board member, Dr. Patel. Welcome.
Thank you, Carolyn. Really excited about being a new member of this group, and nice to meet everybody virtually.
Great. Summa, do you want to just briefly tell everyone a little bit more about yourself to your fellow board members, since we're not together in person? Thank you.
So hi, everybody. I'm Sumair Patel. I've been practicing podiatry in California for almost 20 years. I work at the Kaiser Santa Clara facility, where I have served as chief and currently serve as the chair of the chiefs for the Northern California Podiatry Group. I also have an administrative role in the Santa Clara Medical Center Hospital, where I oversee cardiac and cath lab. I live in Santa Clara. I've got 2 kids, and so I'm excited to be a member of this group again.
Fantastic. Thank you and welcome. And just a reminder to all of us here that our duty is to protect and serve the citizens of California in regards to podiatric medicine, and that's the focus of our time here together. I'd like to next comment on that, to ask if there's any public comments on items not on the agenda.
Thank you so much. This is the moderator, and for public comment, we're using the hand raise feature. So if we could have the public comment slide showing slide 5. We can just move to the next slide. We have instructions. Thank you so much. And so if you'd like to comment, please raise your hand. If you've called in, you can press *3. Otherwise, if you hover your mouse next to your name, you should see a hand that you can raise, and we'll give you a moment. All right, I'm seeing no hands raised at this time.
Fantastic.
And Dr. McAloon, this is Brian Naslin, the Executive Officer. Can we go back to item 1 and just for our minutes for documentation? You've already called the meeting to order, but let's go ahead and do a roll call to establish a quorum.
Fantastic. Thank you very much. Kathleen, are you available to do that for us?
Yes, I am. Good morning.
Thank you. Good morning.
Good morning. I'm going to call the rolls and the votes, officers first and then in alpha order. So here we go. Dr. Carolyn McAloon.
Present.
Darlene Trulio Elliott.
Present.
Excuse me, Daniel Lee, Vice President. You should have been next.
Present.
Samantha Chang. I don't believe she's here. And I don't believe Devin Glazier, DPM, is here as well, but I'll call him Devin Glazier. And Sumar Patel, DPM.
Present.
We do have a quorum.
Fantastic. Kathleen, thank you so much for taking roll, and I apologize for missing that step.
You're welcome.
Thank you, Brian. Keeping me on track. I need all the help I can get. All right, then resuming our agenda, board members, ideally, we have all reviewed the minutes from our last meeting on June 1st, and I'd like to request a motion to accept the minutes from our last meeting. And then we'll go from there.
I second that motion.
I'm going to ask one of you to make it first.
Oh, I'll make a
Yes,
motion to accept
this
the
is Daniel Lee. Accept the minutes from our last meeting.
Thank you so much, Daniel. Are there any comments on the minutes from our last meeting?
Do we have a second on that? I didn't hear.
Dr. Lee moved, and who seconded?
I did. That's Mr. Mayor.
Thank you.
Great, thank you for getting clarity on that. I know when we're not in face-to-face, sometimes it's hard to recognize voices. But we'll make it through. Great. So thank you. We have a first, we have a motion to accept the last meeting minutes and a second. Is there any discussion of the meeting minutes from our June 1st, 2023 board meeting? Hearing none, may I ask for a vote on accepting the minutes from our last
Quick
meeting?
point of order, we should be asking for public comment as well.
Fantastic, thank you. Is there any public comment on the board meetings from the June 21st, 2023? Thank you.
Thank you, Madam Board President. If any member of the public would like to comment on the minutes, please raise your hand. You may do so by mousing next to your name and clicking on the hand, or if you've called in, you can press *3. We are displaying instructions and we'll give you a moment. All right, this is a moderator. I see no request for comment. I return the floor to you, Madam President.
Thank you. Kathleen, would you take a vote on the accepting the minutes from our last board meeting?
Yes, I will. Board Member McAloon. Welcome.
I accept them.
Lee,
Accept.
Elliott,
Yes.
Patel.
I accept.
Thank you. Motion passes.
Fantastic. Thank you for accepting the minutes of the last meeting. And I know it goes without saying that it's best to review the materials ahead of time so we can have efficient meetings. Thank you, everyone, for doing that. I appreciate you. So the next order of business is to receive the reports from our different areas of our committees. And then, Dr. Patel, I'd like to invite you to start with the update and possible actions on the licensing program. I know this is your first meeting. I might suggest when you take over this portion that you invite our wonderful licensing staff member, Andrea, to deliver the report on your behalf.
Thank you for that reminder. Yes, I will.
You are so welcome. For the first time,
I would like to thank our wonderful licensing coordinator, Andrea, to give the report.
Okay, so good morning. The following information is for the fourth quarter of fiscal year 22-23 between April 1st and June 30th. There were 22 newly licensed DPMs with 13 pending applications with 3 candidates that recently completed their package. For the fiscal year, PMDC had 21 applicants come from out of state. 40 were third-year residents from California and 33 were third-year residents from an out-of-state program. Next, for the renewals, there were 292 renewals mailed with 269 licenses renewed in quarter 4. There were no new residents added, so the total number is still at 130. And next we have the discussion regarding the DPM's request to use additional certifications. An update regarding that. Per the board's request, the DPM submitted the proof of the 50.5 CMEs. Additionally, we received a letter from Kent State confirming that their master's in public health is relevant to pediatric medicine and is attached for the board's review. This is to satisfy the continuing competence requirement, section G, as an extended course of study within the last 5 years.
Thank you. Andrea, I have a question for Brian and for council. Does the board need to vote on whether this information satisfies the requirement?
Yes, that would be probably the best thing to do at this point, take a vote on it. If everybody's reviewed that letter, we have confirmation it does meet the CME standards in section.
Thank you, Brian. background
Hi.
because we have some new members that this licensee had studied a master's in public health, which was not on our list of competencies. And we asked this licensee to provide further details about the program so that we could evaluate his request that this program be accepted as meeting the competencies. And the Kent State sent us a letter, which is attached. The licensing committee reviewed the information, and the licensing committee's recommendation to the board is a due pass on this request. If someone can make a motion on this issue, I would appreciate it.
I'd like to make a motion to approve. I was there at the meeting. This is Daniel Lee, and I was part of the discussion for the approval during the licensing committee and participated in the motion for this. Upon review of the letter, I'm very pleased with the documentation and the commentary of the school in support for Masters in Public Health and the podiatric license in California. So I'd like to make a motion to approve.
Dr. Lee,
Thank you, Dr.
Dr. Lee, could you read me how you want the motion to read? Dr. Lee made a motion to approve in support for a master's. Can you just tell me what the actual motion is?
So it's limited, the motion is limited to this specific situation, and that the board will accept this licensee's Master's in Public Health as satisfying the continuing competency requirement for renewal of licensure.
Is it from a particular university should be in the motion, or just Masters of Public Health?
You can certainly say that it's Masters of Public Health from Kent State University for clarity, certainly.
Okay, thank you.
Thank you, Kathleen, I appreciate you.
Is there a second?
I second.
Dr. Sumar?
Patel, yeah.
Okay. Thank you.
Thank you, gentlemen. Is there any discussion on the request to accept this certification for continuing competency of licensure? Thank you. Is there any public comment on the board accepting this course of study to meet the competencies of licensure renewal?
Thank you, Madam President. If any member of the public would like to comment, please raise your hand by mousing next to your name and clicking on the hand, or if you've called in, pressing *3. We are displaying instructions and we'll give you a moment. All right, this is the moderator. I see no request for comment. I return the floor back to you, Madam President.
Thank you. Kathleen, will you call for a vote, please, on the motion that we currently have before us regarding accepting this course of study?
Absolutely. Board Member McAloon.
Aye.
Lee.
Aye.
Elliott.
Aye.
Patel.
Aye.
Motion passes.
Fantastic. Thank you, everyone, for your, I appreciate the board's due diligence in investigating this request. Well done. Thank you very much. Jerry, thank you. Could you resume the report?
Finally, we just have the 3-month timeline, and that would conclude the licensing report if there's any questions.
Any board questions or concerns for our licensing chair or staff member at this time? Do I wait to the end to ask for public comment or on each individual committee report? If anyone knows the answer to that.
I would think best practice would be to do it after each individual committee report.
Thank you. I appreciate your advice. So before moving on, is there any public comment on the report from our licensing program?
Thank you, Madam President. If any member of the public would like to comment on the licensing report, please raise your hand by clicking on the hand next to your name, or you may press *3 if you've called into the meeting. We are displaying instructions and we'll give you a moment. All right, I see no request for comment. Madam President, I return the floor back to you.
Fantastic. Thank you very much. Good morning, Darlene. I would like to invite Ms. Trujillo-Elliott to give us the enforcement program report.
Good morning, everyone. This is Darlene Trujillo-Elliott. I am going to go ahead and ask staff to go ahead and update us on the enforcement program.
Good morning. This is Bethany DeAngelis, the Enforcement Coordinator. Today's report covers the fourth
we
quarter.
miss you.
What's that?
I said, welcome. We miss you. Thank you for being here.
Thank you. Today's report covers the fourth quarter of fiscal year 22-23. That's April 1st through June 30th, and also includes some data for the full fiscal year. We'll start with the attachment A, which is the complaint data. This is the enforcement statistic portion. We received a total of 46 complaints for the fourth quarter. This is a 53% increase over the prior year's fourth quarter, but once you see the full year's report, you'll see it's really not that different at the end of the year. Average days to close or assign a case was 5 days within the DCA target of 10 days. Attachment B covers the investigation data. This is both desk investigations and field investigations. During quarter four, 44 desk investigations were assigned and 17 desk investigations were completed. Processing time averaged 33 days, which is a 37% decrease over the average of 52 days the previous quarter, or fourth quarter. We did not have an assigned consumer complaint analyst between March and June of 2023. Julie Brown had left for a few months, and then she unretired and came back, which was wonderful because things really slowed down while she was gone. So she's caught us up now and is back working our complaints at the desk level. For field investigations, there were 3 field investigations assigned and 7 cases completed during the fourth quarter, which averaged 336 days to complete. Then case investigation times, which include desk and field investigations, had an average of 166 days to complete, which is a little above the DCA target, but that's pretty common for most boards. It's kind of hard to reach those targets for investigations and the AG data as well. So out of the total case aging, 15 complaints closed during quarter 4, 8 were closed within 90 days, 4 were closed between 91 days and 1 year, and 3 took longer than a year to close. And just a note on costs that investigation costs are continuing to rise. Unfortunately, we don't have a lot that we can do about that. They've increased hourly rates, and we have our mission of public protection, so we the costs are what they are. All right, moving to attachment C is our disciplinary data. So 6 cases were initiated during the fourth quarter. That's a 200% increase over the prior year's fourth quarter. 3 final orders went into effect compared to 2 the prior year, and 2 citations were issued during fourth quarter. We had no probationers added during the fourth quarter, but there was a successful completion of probation and 1 license surrender of a probationer. And at the end of quarter 4, we had 8 licensees on probationary status. Attachment D shows the full fiscal year. So this is each quarter compared to the prior fiscal year. So this is July 1st through June 30th. Total complaint intake decreased by 7%, with a total of 133 complaints received this year compared to 143 complaints the prior year. Total investigations assigned decreased 9%, with 130 investigations assigned. And the average days to complete investigations for both desk and field were 175 days, which is a 12% decrease over the prior fiscal year. 14 new disciplinary cases were initiated through the Office of Attorney General, which is a 17% decrease from 12 cases initiated the prior fiscal year. And the disciplinary cases took an average of 1,238 days to complete. We had 7 final orders for the fiscal year, same as the year before. A total of 2 citations for the fiscal year. And that concludes Attachment D. For Attachment E, we have the Attorney General case aging data. This is information received directly from their office, and that report was received on September 25th, 2023. Shows that we currently have 15 plus active cases pending completion. Some of the cases forwarded to the AG may not show on their report yet because they haven't been formally accepted yet based on meeting review or additional investigation. And Attachment F shows the total trend of complaints initiated since the implementation of the Continuing Competence Program back in 1999. So this is 25 years of data of the numbers of complaints that our board has received. Now, in 2021, the board voted to delete the need for continuing competence. And so DPMs can renew their licenses just by completing the 50 CMEs and not having to supply the additional continuing competence portion. And this goes into effect on January 1st of 2024. So this upcoming January 1st. I don't know if this is going to change how the board wants this reported in the future. If you guys want to continue to see 25 plus years of data, or if we want to, keep it to, 25 years or 20 years or 10 years, whatever the board may, we can discuss that today or at a future committee meeting, how the board would like to see this data going forward. But with the elimination of the continuing competence program, we may want to, make a little change to that.
Andrea, thank you for that. I propose that we turf that to the committee to come back and give us the full board their recommendations on how to proceed with that data.
Okay. Sounds good. And then we have Attachment G, and this is provided yearly at the end of the fiscal year. And this has some specific data regarding the licensees disciplined. It goes back to fiscal year 13-14.
Sorry to interrupt, Bethany, but quick point of order. If for the recommendation to come back, there should be a motion and a vote.
To send that to a committee to discuss that issue?
Yes.
Yeah, sure. I will. I'll make a motion that we ask the committee to consider how they would like the data presented to the board regarding complaints received since implementation of continuing competence.
We'll second that motion. Darlene.
Thank you. Is there any discussion on asking the committee to review this issue and present their recommendations back to our board?
Let me just repeat the motion, okay?
Thank you.
Dr. McAloon moves, Elliott seconds, to ask the committee to consider how to present data regarding Bethany, what is it, continuing competence?
Yeah, complaints received, number of complaints received since implementation of continuing competence.
Okay, thank you.
May we ask for any public comment on requesting the committee to examine this issue?
Thank you. This is the moderator. If any member of the public would like to comment, please raise your hand. You may mouse over the hand next to your name and click on it to raise your hand, or if you've called in, press *3. We are displaying instructions and we'll give you a moment. All right, I see no request for comment at this time. Madam President, I return the floor back to you.
Thank you very much. Kathleen, would you please take a vote on the motion to ask the committee to make recommendations on how to present going forward the complaints regarding essentially implementation of the continuing competency requirements?
Yes, thank you. Board Member McAloon,
Aye.
Lee,
Aye.
Elliott,
Aye.
and Patel.
Aye.
Motion passes.
Thank you, everyone. Let's see, Bethany, Bethany, can you, you probably know best where exactly.
I'll continue.
Thank
I
you
was
very
at
much.
attachment G.
Perfect. Thank you very much. There we go.
No problem. So attachment G is information on licensees' discipline since fiscal year 13-14. And it provides some information on the school that they attended, the residency, the type of discipline, their age, gender, and years in practice at time of discipline. This is just so the board can see if there's potentially any schools or residency programs or areas of deficiency, and is provided for just information and review. And finally, to end the statistical portion, is just some information that we have a DCA Open Data Initiative reporting tool that includes data through fiscal year 22-23, and it gives a website where that information can be viewed. I'd like to ask the board if they have any questions at this time on the statistics.
Hi, Bethany. This is Daniel Lee. Thank you so much for the report. On our aging file, and I know we sometimes go back to the aging report, case number 2 seems to be quite old, and possibly the last dated was 2021. Is that because of lack of agents, or would you have any updates on that particular case? It just seems to be one of the older ones without any updated dates, with the last request maybe 2021. The other one seemed to be at least 22.
Right. Yes, we have a case that has been in play for a number of years now, and it actually resulted in a discipline, and then there was an appeal and it came back, and so it is with the Attorney General's office at this time. It's been problematic getting a hearing date for this case, and it's been in quite a fight with this individual and their attorney. So I don't really have another update, as I don't know when that case is going to be. It's actually older than what the report shows, because this is when it came back to us after the appeal, and it's been ongoing for many years.
Oh, I see. Because I remember seeing this for a few times. I just wanted to see if there was any updates. Thank you so much.
You're welcome. I will follow up with the attorney. I followed up recently and didn't hear back yet, but I'll follow up again and see if I can get the latest status on that. But I know it's just, this has been a problematic case that's been, it's just been taking a lot of time. Hopefully it closes soon. Any other questions on the statistical data? Okay, well, I will move on to segment 2, the probation program update. And we just have a little bit of cost recovery update here. So between April 1st and June 30th, we received $12,034.66 in cost recovery payments, $3,284.60 in probation monitoring payments, and a citation payment of $1,000, for a total of $16,319.26 in enforcement cost recoupment for Q4. Any questions on that? Okay, and moving on to the final consultant and expert program update. At this time, all of our expert consultant contracts are set to expire December 31st, the end of the year. The contracts, forms, and instructions were mailed out to all of our consultants and experts with instructions to complete and return by the end of this month. I've seen quite a number of them come in, and once they come in, they'll be forwarded to the contracts office for processing so that we can get our consultants and experts paid for their work moving into 2024. And that concludes my enforcement report, unless we have any future questions or discussion.
I have a question. Do we have our next training scheduled for our consultants and experts yet at this time?
I have not yet set that. It will most likely be an online training. This year's been a little problematic for me, but I will be working on that. Get started on working on that actually probably after this board meeting. So hopefully.
So it's to have a training in 2024?
Yes, I do hope to have a training in 2024.
Okay, fantastic. Thank you. Are there any other questions or concerns for Bethany following the report on discipline? May I ask for any public comment on the report?
Thank you, Madam President. If any member of the public would like to comment, please raise your hand by either mousing over the hand next to your name and clicking on it, or if you've called in, press *3. We are displaying instructions and we'll give you a moment. This is the moderator. I see no requests for comment at this time. Madam President, I return the floor back to you.
Thank you very much. Good morning, Daniel. Dr. Lee, can I ask you to present the legislative regulation report?
Great. Thank you, Madam President. I'd like to ask Kathleen Cooper to help us to present this report for us. Thank you, Kathleen.
Thank you, Dr. Lee. Good morning again, and I'm going to present this legislative cycle, this report from 2023, which was very successful for PMBC. There's 3 bills. The third will be discussed by our new attorney, Brennan Meyer, and that is how we're going to meet and comply with the Bagley-Keene Open Meetings Act. So that's the third one. That's SB 544 by Laird. The 2 bills that we've been following this year that directly impact the Podiatric Board are AB 826, sponsored by Chen, which has to do with DPM renewals. This bill was enrolled on September 7th. It did not have any opposition. And a short summary of the bill, for those that are still here from 21, you might remember that the board voted in March 12th of 21 to allow DPMs to renew their licenses by completing 3 things: 50 CMEs, remaining free from disciplinary actions, and paying fees. It was self-imposed about 25 years ago, as there were DPMs that were surgically trained if they graduated from podiatric medical school after 1983, and those that weren't and had to be certified. So this was done to allow more consistency. But at this time, all DPMs are surgically trained. There was a presentation from the Federation leader. I'm not sure if he's an executive officer, but he presented to us that no other state had this requirement, and it's possible that it could be challenged as a restraint of trade. So California never wants that. What ended up happening, and maybe Brian, you can address exactly how you did this, but it just kind of sailed through the Assembly and the Senate and was signed by the governor without, as I said earlier, opposition. But we did sponsor this bill. Is there anything you'd like to say, Brian, about how you succeeded with this?
Yeah, sure. I just needed to unmute myself. I was going, but I was muted. This bill right here, Kathy said back in 2021 was voted by the board. However, we had that unique pandemic situation, and the legislature, uh, they didn't want to take in any other bills rather than budget bills or bills related to COVID. So that's why in 2023, it was all queued up, ready to go, and then we found Phil Chin, Assembly Member Phil Chin, and he took the bill. He authored the bill. We sponsored, and so did CPMA co-sponsored as well. I've never had a bill go through like this before. There was just maybe a 30-second phone conversation for some testimony. That was it. And I'm like, this is, I'm ready to go to the Capitol and go to battle, but it never went that way. It just sailed right on through. So I wish all bills would go this way. But it's a huge win for DPNs because it lays out the model just like MDs and DOs. They do the same. They pay their fees, 50 units of CMEs in good standing. So it kind of lines us up with the MDs and DOs, and now DPMs come January 1st, 2024, would be set in that same situation. So good leadership from the board, and fingers were crossed, and here we go. We got it. So it was a big win.
I'd like to acknowledge our executive officer for this. I think this was a great win for our board and modernizing our board, and especially his great work taking this bill to the Assembly and Senate and getting involved with all our stakeholders and our bill carrier to achieve this. I know this goes back 2-3 years in the making, but I'd like to publicly acknowledge our EO for taking care of this great work. Thank you, Brian.
Okay.
You're welcome. Am I still on mute? You're welcome, Dan.
Okay, so that's 826. I think the licensees will be very happy when we put this up on the website and send out a message on our listserv. So for any DPMs talking to other DPMs, please make sure that they're aware of this change as well. It's effective January 1st. Okay, next bill. Unless there's any comments, anyone else on 826? I'll go on to AB 834. This was sponsored by Assembly Member Irwin, and it was enrolled on September 8th. This was sponsored by the California Podiatric Medical Association, and it eliminated the requirements that a DPM could not hold a majority interest in certain partnerships. So there was no reason that anyone could speak of at this point as to why that would still hold true. Maybe in the past there was some reason, but everybody agreed, and this one pretty much went through as well. We did send a letter of support, however, we weren't really the sponsor. There's an attachment that lays it all out. If anybody has any comments or questions, please let me know now. Otherwise, this is also passed. And DPMs can now own majority interest in partnerships with MDs, DOs, etc. Having no comments. The next bill is a Senate bill, and we all know how different things are since COVID and how it changed the virtual meeting and teleconferencing. Our new attorney, Brennan Meyer, would you like to make a presentation on the new changes as of January 1st?
Yeah, I'll be happy to. As Kathleen mentioned, there has been a lot of changes regarding the way we can host teleconference meetings. So to be clear, currently we're hosting complete virtual teleconference meetings under section 11133, which, as you can tell, everything's virtual. No one has to have a camera on. Very straightforward Zoom meeting-esque participation. This ability, though, ends on December 31st of this year. And starting January 1st, we have a variety of new, in some case, old options to host teleconference meetings. It's important to note that there is still the traditional everyone meets in person. You have an in-person meeting following traditional notice requirements. That being said, there are 3 teleconference options, and only 2 of those options are going to be applicable to PMBC. The first option is currently in statute. Under this option, and the board can host a teleconference meeting where there's at least one in-person location. However, every location that is teleconference has to be noticed in the agenda. So that means if a board member is meeting remotely, they will have to disclose their location and provide public access and ensure that a location is ADA accessible. The next option is a new option put into law. Underneath that, a majority of the board members have to meet in a physical location, but once there is a majority, additional members can meet in a remote location that is not disclosed to the public. But if there's anyone 18 years of age or older at that same location, that individual will have to be disclosed as long as the relationship with the board member. And then finally, there is an option for advisory boards, but PMBC does not have any of those. So it's a little irrelevant for this board's purposes.
Thank you for sharing us with the details of how that looks going for our meetings going forward.
Okay. So that concludes the legislative section. Unless there's any questions on the last presentation.
Brian, do we discuss now what our thoughts are for 2024 regarding this issue? Is this the appropriate time to have that conversation?
I think we could do it when we get down to scheduling the committee and board meeting dates.
Fantastic, thanks. That's what we'll discuss it then.
Okay, so we'll go to...
I'm sorry, Kathleen, my apologies. Go ahead.
If we're ready, we could go on to the regulatory program update.
Thank you.
Okay. We have the same pending bill. It has to do with enforcement issue called disciplinary guidelines. And this has been pending for quite some time, but we're really hoping to tie it up in 24 and finalize it either at the beginning of 25 or at the end of 24. And just so people understand, we currently have disciplinary guidelines incorporated by reference, but there could be some updates to modernize them. It works. If Bethany has any comment or Brian, it's been working. If we have any substance abusing or other disciplinary problems, we do have an action plan in those disciplinary guidelines, but we would like to make it compliant with an original bill, SB, I think it's 1441, and that's our plan to do in 24-25. Kind of the same old report we give every board meeting on this issue. We have a little bit of work to do, but most of it is done. So apologize for the delay in that. It does involve many people and parties, and the DAG and other lawyers have been involved. So we hope to tie it up in the next cycle. And that, if there's no questions on disciplinary guidelines or comments, concludes the legislative regulatory report.
Thank you, Kathleen.
Mm-hmm.
Do any have any questions for Kathleen regarding this report, either the legislative or regulatory update portions? Is there any public comment on this report?
Thank you, Madam President. If any member of the public would like to comment, please simply raise your hand. You may click on the hand next to your name if you're logged into the meeting, or press *3 if you've called in. We are displaying instructions and we'll give you a moment. This is the moderator. I see no requests for comment at this time. Madam President, I return the floor back to you.
Great. Thank you very much. Mr. Hugh Elliott, may I ask you to give the public education report, please?
Good morning, everybody. I am going to go ahead and ask Kathleen if she could step in and go ahead and review the report for all.
This is the moderator and Kat. Oh, there you go.
Okay, so this is the public education program report. We're going to talk about the footnotes, number 1, and number 2, social media. We're going to put over till next March, the third part of this agenda, and we will discuss it at that time. The first thing I'd like to talk about is footnotes. So we're getting ready to close footnotes, and we will be doing that at the end of the year. I'd like to thank everyone who has contributed in one way or another to the submissions in the past, and ask that if anybody has anything they would like to make sure that our membership, our licensee base, our stakeholders, schools, residency programs, and other issues relating to podiatric changes or updates in the country, anything, we will accept those for submission until the end of 23. It's been a success in the past, and we just hope to keep continuing it with this publication deadline to get 24 out. And if anyone has any comments, I'd like to specifically thank Board Member Lee, who has done some fabulous work in getting us residency submissions. And Dr. Lee, if you'd like to address anything you might want to submit this year, I think you told me you might have 1 or 2 ideas for footnotes 24, let me know.
Oh, hi, Kathleen. Yes, we have 2 articles under manuscript at this point. One having to do with early practice as one transfers from a licensee as a resident into a full licensed practitioner, and how that transition works and how that applies to our public health and their work into the profession. The second article is quite unique. It has to do with one of our medical students transitioning from DO program into a DPM program, and how he was able to marry those 2 programs together, and his thoughts about both disciplines and professions. So they seem to be wonderful pieces of manuscripts with great content. We'll be finalizing the drafts and submitting to you before the end of the year. Thank you, Kathleen.
Okay, thank you, Doctor. Are there any comments?
Definitely, thank you. I was going to say thank you for making that happen. That sounds like great content for both the licensees and the public. Thank you very much. Strong work.
Yes, and for making my job a little easier too, Dr. Lee. Thank you.
Always a good thing.
Yeah. Okay. The second agenda item and the last agenda item we will discuss today is the social media and website aspects of PMBC's outreach. I'd like to thank Andrea and our licensing department for assisting us with one of the goals that was mentioned in the strategic plan, but also something that we've always wanted, which is to increase the listserv. We're doing pretty well with that. I think it's 4 times what we used to have now. And she does that somehow through her licensing processing actions. So when we send out a listserv, it's not just staff and a few other people. It is a wide range of stakeholders. And that is how we get the message out, I think, number 1. Number 2, we reach out to the California Podiatric Medical Association, and they also assist us greatly with getting the message out. They, I think, have a similar listserv type thing where they send that out and talk about it among their board members and other committees, etc. And so whenever we have something to get out, that's our main 2 ways of doing it. We do have Facebook and Twitter accounts. They're rather inactive, and I'm not so sure we want to make them too active, because we start getting kind of unrelated requests, from different countries that we really don't have as part of our mission to spend resources. But I would like to just reiterate to everyone, if you go on the website, there's some deep tunnels in there from days gone past, and there are some sections that I am made aware of regularly that might be out of date and the content we would like to update. So please don't hesitate to send me a message if you see something like that, or a question you might have about something on the website that doesn't seem to be right or current. I have no other comments other than that. We're getting more and more active with our website. I think once again, it's because of Andrea's section with the licensing. Everybody is renewing now electronically, and it gets them involved. So that's it for the social media website and report.
Thank you, Kathleen. And I just want to say also thank you, Dr. Lee, for again providing such great articles, and also Andrea and Kathleen for all your help. Thank you.
Thank you. You're welcome. So that concludes my report.
Are there any board questions or comments regarding our public education program report? Is there any public comment on our public education program report?
Thank you, Madam President. If the public would like to comment on the education report, public education report, please raise your hand by either clicking on the hand next to your name, or if you've called in, press *3. We are displaying instructions and we'll give you a moment. All right, this is the moderator. I see no request for comment at this time. Madam President, I return the floor back to you.
Fantastic. Thank you very much. Moving on to agenda item E, the executive management report. In regards to this point, is setting our calendar for 2024. As I mentioned at the opening of this meeting, that this is our final meeting for 2023. Thank you, everyone, for serving with distinction this year, and looking forward to all of us serving again together in 2024. Setting the calendar is important. We are, as far as board members, staff are not volunteers. They have to show up regardless, but we are volunteers, and coordinating our schedules in advance is important. We're all busy professionals, whether we're licensees or not, and setting up our agenda for the year is important. So that's what the plan is for today. Unfortunately, for example, today we have 2 missing board members. In their defense, they are recent appointees, and were not on the board when the 2023 schedule was made. So the good news is that we all of us currently, we may have another appointee next year perhaps, but currently are all here now. So the good news is we'll all have the dates of the meetings well in advance on our calendar, so that we can continue our duty to protect and serve the citizens of California. Because of course, if we don't participate or, in our meetings, we're not fulfilling our duty to do that. So I'm looking forward to getting these dates on our calendars. This will be in the report, but but if you'd like to take notes at this point for your own personal calendars, we currently are going to continue with 3 meetings a year, 3 board meetings a year. And as we talked about briefly, that there has been changes in the law regarding meetings. We've been doing WebEx since the pandemic, and that will the ability to do that the way we have been is expiring. As you heard our legal advisor educate us about our options. Basically, having remote where our location is accessible is I don't believe to be a practical scenario. That leaves us, the majority of us meeting in person at a fixed location that is open and posted to the public. In that regard, then, we will resume in-person meetings in 2024. Typically, to enhance participation both for our board members' convenience and for the public's convenience, the plan is to hold 2 meetings in Sacramento and 1 in Southern California. And so the dates of the executive committee worked together with our executive officer to select the committee meeting dates to be calendared, which will have been selected as February 23rd, June 7th, and October 11th. You may note that those meetings have been moved to Fridays. While we used to meet in person on Fridays during the remote pandemic, we had moved our meetings to Thursdays. Going next year, we'll be moving the meetings back to Fridays. And the expectation is that the June 7th meeting will be held in Southern California. I have reached out to the dean at Western University, Dr. John Leibovitz, to see if they may be able to host us for that meeting. I do not have a reply as of yet, but I'll be working with Brian to get that set up. Before moving
Carolyn,
to the committee meeting, I'll stop there for a second for discussion. Yes.
Yeah, I think Dr. Lee, didn't you have a conversation with the Panoma School?
Hi, everyone. This is Daniel Lee. I was having a side conversation about other matters with the dean at Western U and happened to recall our board's thoughts, and the dean was more than happy to host us. And I think it will be just a matter of the board down the road contacting the university, and they'll be more than happy to host us for that meeting. So I think we can pencil that in right now. Just wanted to give you an update.
Okay, and I'll reach out to him and start that process. So June 7th board meeting is going to be in Southern California. And then Carolyn, too, we have to talk about the committee meeting dates.
Yes, I was just going to take pause for this moment. Certainly, I have if there's any other questions about what I have discussed so far.
Okay.
Hey, this is Samir. I have a question about the board meetings in terms of timing. Is, again, as a new member, are these board meetings set up like similar today with a sort of a 10 o'clock start to allow us to travel to the site in the morning, or are we going to be starting early in the morning, therefore we may need to go there the night before?
You are exactly correct. We start at 10 a.m. To allow for travel times. And so the meetings do tend to be the same, starting at 10 a.m. and running through until we are finished, which typically, all I can go is by past. This is no promise or guarantees going forward. But typically, our meetings would run 3 to 4 hours when we were in person back before the pandemic.
Thank you.
You bet. Any other questions about our meetings? Going forward to Brian's next point, so as you know, our committee meetings are held several weeks before our board meetings to prepare for those meetings, and those will set up to remain as a held versus via teleconference and not in person, as we have been doing. So the committee meeting structure will not is not expected to change. So having advanced, so the 3 committee meetings, which will be in advance of our board meetings, would be January 30th, prior to the February meeting, May 7th, prior to the June meeting, and September 17th, prior to the October meeting. Is there any discussion about the committee meeting structure? Thank you. Is there any public comment on the discussion on picking dates for committee and full board meetings for 2024?
Thank you, Madam President. If any member of the public would like to comment, please simply raise your hand by clicking on the hand next to your name, or if you've called in, press *3. We are displaying instructions and we'll give you a moment. All right, this is the moderator. I see no request for comment at this time. I return the floor back to you, Madam President.
Thank you very much. My question is the calendar for our board meetings in 2024 an actionable item that requires a vote, or is that set at the discretion of the president?
You should take a vote on this and with a motion that clarifies the dates of both the public meetings, including that the June one will be in SoCal.
Thank you. I appreciate your advice on that. Kathleen, were you able to note the dates of the meetings and the committees for the motion to accept the calendar as I've presented it? Which I will make a motion to do so.
Let's go ahead and recap the dates just so everybody's online here and there's no confusion. What I got noted down is committee meetings, January 30th, May 7th, September 17th. That's correct, right?
That is what I have as well.
Okay, and then board meetings, full board meetings, February 23rd, June 7th in Southern California, and October 11th. Is that what you have? Is that what everybody has?
That is what I have.
Okay, perfect.
Sorry, Brian, did you say that the committee meeting was September 17th or October 17th? I might have just misheard you.
Yeah, September 17th for the committee meeting, yes.
Okay. And Dr. Micklin, did you make that motion? And I guess we need to.
Did. I made a motion to accept the committee and meeting dates for the Podiatric Medical Board of California in 2024.
Okay, we need a second.
A second.
Dr. Lee, okay.
Thank you. Any discussion? Is there any public discussion on the motion before us regarding accepting the calendar of meetings for 2024?
Thank you, Madam President. If any member of the public would like to comment, please raise your hand by clicking on the hand next to your name or simply pressing *3. If you've called in, we are displaying instructions and we'll give you a moment. This is the moderator. I see no request for comment at this time. Madam President, I return the floor back to you.
Thank you. Kathleen, would you take the vote on the motion before us, please?
Yes, to repeat the motion by Dr. McAloon and seconded by Dr. Lee, that the calendar meetings for PMBC in 2024 will be board meetings on February 23rd, June 7th, October 11th, and the committee meetings will be on January 30th, May 7th, and September 17th, with the June meeting in Southern California. I will now take the vote. Board Member McAloon?
Aye.
Lee?
Aye.
Elliott?
Aye.
Patel?
Aye.
Motion passes.
Fantastic. Thank you, everyone.
That went smoother than I thought. Remember last year when we had scattered dates?
It's so long last year.
Yeah.
Well, thank you.
It helps when we're pre-queued.
Yeah, exactly. And I think the last of business we need to do for the executive officers' reports is take get a motion and get a second to either accept or deny those.
To accept all the reports, Brian, is that the motion we need?
Yeah, is that Brendan, is that how we usually do it that way?
Yes, that should work just fine. So just motion to accept all the reports.
Yes, all the executive officer reports, yes.
From the board members, may I request a motion to accept all the reports, executive officer reports that we have received today?
Yes, I'd like to make a motion to accept all the reports from the executive officer.
I second that motion.
And who was the
Discussion?
second? Was that
Samir. Yeah.
Okay, okay.
Now we take the vote.
I just need to make sure I've followed all the protocols. Any discussion on accepting the reports? Any public comment on the motion to accept the reports given today?
Thank you, Madam President. If any member of the public would like to make a comment, please raise your hand by clicking on the hand next to your name or simply pressing *3 if you have called in. We are displaying instructions and we'll give you a moment. This is the moderator. I see no request for comment at this time. Madam President, I return the floor back to you.
Thank you very much. Kathleen, could you please take a vote on the motion to accept the executive officer report?
Yes. So the motion by Dr. Lee, seconded by Patel. The vote count, board member McAloon,
Aye.
Lee,
Aye.
Elliott,
Aye.
and Patel.
Aye.
Motion passes. Thank you very much, everyone. Per our agenda, that concludes the open portion of our meeting, unless there's any additional comments and concerns before moving to closed session. Then may I ask our host and co-host to assist us in moving from open to closed session. Thank you.
All right, this is a moderator. I promoted the staff back so that they can participate in the meeting. I'm going to make Michelle the presenter again in just a moment. All right, Michelle, you are now the presenter again, and everyone that needs to be a participant in this meeting is now back to being a participant.
Welcome back, everyone, to open session of today's meeting of the Podiatric Medical Board. The item we have left to address is future agenda items. Does anyone have anything they'd like to bring forward at this time? Brian, do you have anything else to add to our meeting today?
I do not. You make my job easy, Carolyn.
I'm glad to do so. You make my job easy. It only seems fair.
Okay.
If there are no further agenda items on today's meeting, then I move to adjourn today's meeting of the Podiatric Medical Board. Do I take a motion to do that?
Yes.
This is the moderator. I'm sorry, did you need to take public comment for future agenda items?
Oh, I think you're quite right. Thank you for reminding me. Are there any public comments on future agenda items for the Podiatric Medical Board of California?
Thank you so much. This is a moderator, and if any member of the public would like to comment on future agenda items, please raise your hand by clicking on the hand next to your name, or you may simply press *3 if you've called in. We'll give you a moment. All right, this is the moderator. I see no requests for comment at this time. I return the floor back to you, Madam President.
Thank you for your help. I appreciate it.
You're welcome.
As there's no further agenda items on the today's meeting of the Podiatric Medical Board of California, I want to thank board members, executive officers, staff of PBNC and of the DCA in assisting us with accomplishing our mission of protecting the citizens of California in regards to podiatric medicine. And I make a motion to adjourn today's meeting.
Second.
Any discussion on adjourning the meeting? Any public comment on adjourning the meeting?
This is
Do I
moderator.
just adjourn it or do we need to vote?
Yes, you can just adjourn it.
Okay, meeting adjourned. Everyone have a great day. Thank you for all your hard work and looking forward to talking to you all soon. Take it easy. Bye-bye.
Bye. Thank
Thank
you.
you, everybody.
Thank you, everybody.
Thank you.